Hello, everybody. This is Gary. Today is November 19th, 2021. It is 3:19 p.m. Eastern Standard Time in the United States in Rochester, New York. This is my coping with schizophrenia blog entry for today. Today I'm doing pretty well. My anxiety levels are not that high. My paranoia levels are pretty low. My hallucinations are not that intense. Um, my depression is not that bad. There's not really much to report on. I have a therapist appointment next week, I believe on Wednesday of next week, the day before Thanksgiving. I'll be meeting with my crisis therapist, who I'm hoping will be my permanent therapist. That hasn't been decided yet. There's no doubt that I'm getting a permanent therapist, and the therapist I've been seeing is a crisis therapist, meant to get me through some difficult times, and then wait to assign me a new permanent psychotherapist. But the therapist I have now may turn out to be my permanent psychotherapist, but I don't know yet. The reason I got a psychotherapist is because I was just what was in medication clinic or med clinic. I was just going to my mental health clinic just to see the psychiatrist to manage my medications. I didn't have a therapist. I still don't have a care manager, but I did agree to see a psychotherapist in exchange for being on Klonopin, which can be addictive if misused or mishandled. It can be physically and mentally addictive. So my psychiatrist wanted me to start seeing a psychotherapist in exchange for my being on Klonopin. Eventually, at some point, we're going to have to withdraw the Klonopin. That will be reviewed on a periodic basis throughout the winter, according to my psychiatrist. Right now, there's no plans to withdraw the Klonopin anytime soon. Klonopin, of course, is meant for anxiety. It is not meant to treat psychotic symptoms like delusions, paranoia, hallucinations, either visual hallucinations, auditory hallucinations, tactile hallucinations, or any other kind of hallucinations. Klonopin is strictly for treating anxiety and panic attacks, which I have a lot of. Today things are not so bad. The only thing I did today was run some errands. Um, I did break down and buy a pack of cigarettes, but when I'm done smoking that pack, I'll go back to using the nicotine lozenges. My smoking has been back and forth. Last time I bought a pack of cigarettes was last weekend. I went without a cigarette up until today. I'm not sure why I bought a pack of cigarettes. It's just that I had an overarching urge to smoke a cigarette. And once I buy a pack of cigarettes, because I spent the money on them, I feel I at least have to smoke up that pack before I quit again. I do have nicotine lozenges, 2 milligrams. I will try to quit smoking again when I finish this pack of cigarettes. I am worried about my lungs and my heart being damaged by smoking, but it is a hard habit to break. A lot of schizophrenics smoke cigarettes or use tobacco in some form, usually cigarettes, but including cigars and chewing tobacco. Nicotine is a very powerful addiction. Um, it's not the type of addiction that you would go into an addiction clinic. It's a very difficult addiction that you have to handle on an outpatient basis. My psychiatrist is the one who's prescribing nicotine lozenges. Um, I was on the 4 milligram lozenges, and then we switched to the 2 milligram lozenges to try to reduce my dependence on the nicotine without a clear end date on when I would stop using the nicotine lozenges. Um, One of the things I haven't been doing, which I want to get back into doing because it helps me make extra money, is doing consumer surveys online to get my opinion on different consumer products. There are legitimate survey sites out there that pay for doing that. I haven't done it in a few weeks. I want to get back into doing that. Part of the problem with having schizoaffective disorder or schizophrenia is negative symptoms of lack of motivation to do certain things. And that includes work, school, maintaining friendships, maintaining social relationships, um, exercise, things that I would normally enjoy, that kind of thing. Um, I forget the official name for that. But part of negative symptoms of schizophrenia is a lack of motivation to do certain things. Um, may come across as laziness, but that's not what it is. Um, my positive symptoms, which include hallucinations, delusions, paranoia, are at a minimum right now, but not too intense. Um, I'm not seeing my psychiatrist again until after the holidays. I believe in the first week of September, I have an appointment with him, or maybe the beginning of the second week of December. In the meantime, I will be seeing my therapist on a regular basis. That's why it's less urgent for me to see my psychiatrist. Um, and since I see my psychiatrist only like once every 4 to 6 weeks, it was important for me to also have a psychotherapist to talk to. The difference between a psychotherapist and a psychiatrist is, of course, is the psychotherapist is for talk therapy. She or he does not prescribe medications. The psychiatrist is, of course, a medical doctor who can prescribe medications, and I just wanted to point out those two differences. Um, a psychotherapist can be anybody with mental health training and licensing in the state of New York where I live. That includes social workers, psychologists, um, psychiatric nurses, among other professionals who can be psychotherapists. It depends on the person. I actually didn't ask for the credentials of the psychotherapist I have right now. I've met with her several times. She's very good at what she does, and that's why I would like her to be my permanent psychotherapist. Um, she's very easy to get along with. And one of the things I did tell my psychiatrist when we talked about assigning me a psychotherapist is that I wanted a female psychotherapist and not a male psychotherapist because I get along better, generally speaking, with women than I do men. Um, Even though my psychiatrist is a male, and my other psychiatrist before that was male, I got along pretty well with both psychiatrists. Um, but a psychotherapist relationship is more intense and more personal. You talk about things that are more personal, and I just prefer doing that with a woman than with a male therapist. That's just my personal preference. I don't know if it's some sort of prejudice or bigotry or sexism on my part, but I just prefer a female psychotherapist as opposed to a male psychotherapist. The last male psychotherapist I had, I was talking to his back for about 15, 20 minutes. He was typing on his computer as I was trying to talk to him. He was at his desk with his back turned to me, and I kept repeatedly asking him, why was I talking to his back? And he said, because I have to do some typing. And I said, okay, I'm leaving and I'm not coming back to see you. And I never did. So I didn't have a psychotherapist for a while. That was the first and only time I met with that particular psychotherapist. I've never had a psychotherapist be quite that rude. Well, that's not entirely true. I actually had a psychotherapist who was so overwhelmed with clients that she actually fell asleep during one of my psychotherapy sessions. Um, Not a good look for a psychotherapist. You obviously don't want a therapist that falls asleep while you're talking to them. Not good, not professional. If you're going to do that, shouldn't be in the business. But that's all that's going on for now. Not much happening, nothing too intense happening. Like, share, comment, subscribe. Press the notification bell if you want to know when I put out new videos. Share my videos on social media. It helps my channel grow. And let me know in the comment section if you want me to do a video on a particular topic.